Hello, hi, it's Jinsi here, and today let us discuss about ADHD. If you are someone who already have an understanding of what is ADHD, how it happens, who can have ADHD, how to identify it, or how to support children with ADHD, please move on. If not, please stay with me. Let us have a basic understanding of ADHD. Right, so what is ADHD or attention deficit hyperactivity disorder? It is a neurodevelopmental condition that affects how the brain regulates attention, self control, or behavior. It is generally common in children but can continue into adolescence and adulthood. Now, who can have ADHD? Answer is simple: anyone. There is a common misconception that ADHD is more common among boys than among girls, or some people say it is found more in certain cultures and not in other. We don't have conclusive evidence for any of this, but there are studies saying that ADHD is found more among boys, or the reason why ADHD is found more in the Western countries, I think, could be that they do more testing, as compared to us here in India. Now, anyways, why does ADHD happen? There is no single reason that we can link to ADHD. There are multiple reasons, and some of them are like: one, differences in brain development and activity, like neurodivergency. Second, genetics. That means it could run in the family. Third is prenatal factors such as exposure to nicotine or alcohol could cause ADHD. And there are some studies that link ADHD to premature birth, or say the low birth rate of children. These are all some of the reasons, and there could be more. Now, let's look at three factors or three types of ADHD and how we can identify if our own children, whether as parents or teachers, have this condition. The first type or the first feature we're looking at is inattention. Means children with ADHD, they one common type is children who have this difficulty to pay attention. And how do we identify them? Well, see, sometimes they make careless errors or find it difficult to pay attention to details. That is one. Two, they have difficulty in staying focused. In class, when you teach, you will know, or as a parent, when you give them instructions, you will know it. Three, they're very forgetful. And four, they get easily distracted. No. Five, difficulty in getting things like study table, their bedrooms, etc. organized. So these are five key things you can observe in children who have this difficulty of paying attention. That is the type of ADHD which we can classify as inattention. The second one is hyperactivity. Hyperactivity. Now, how do we know whether the child is hyperactive? One, they keep on moving on the chair. Don't sit still at all. Or they keep interrupting. The third, talking when not expected or when not really needed. Like you're taking a class, and the child immediately start interrupting you and talking to you. uh, Another, the fourth one could be extreme uh, restlessness among these children, or fidgeting is very common among them. They keep moving things. And the fifth one, difficulty, even when in a group playing, difficulty in being quiet, like, or following rules. They find it difficult. Now, the third type, it's called impulsivity. So we spoke about inattention, hyperactivity, and the third is impulsivity. How do you know if they are impulsive? One, difficulty in waiting turn. No, we tell children, okay, wait for your turn. I'm getting this done for you, but they can't wait. They want, they immediately want whatever they're asking for. Answering before the question even is completed. No? Another thing we can observe in them is that impulsive children, they answer before the teacher even completes the question. So one way to identify them. Third, expecting immediate rewards. They do something and immediately they want whatever is the reward that you give them, appreciation, whatever. So they expect immediate rewards. And if you don't give them immediate rewards, they feel desperate. Then, poor self-regulation skills are often observed in impulsive children. Like fourth, impulsive decision making. It's another trait that we see in children with ADHD. Their decision making very quick. Don't think of what would happen next. What would happen if they do something. They never think about it. Impulsive decision making. And the fifth, acting without thinking about consequences. See, they very often, they simply follow what they feel like doing. So they act without thinking about consequences. Now, can ADHD be managed? Yes, it can be managed. See, we need to understand autism and ADHD are different. They are not one and the same. We can manage ADHD. Sometimes parents ask, like, are there medications available for ADHD? Yes, medications are available, but opt that only when a registered medical practitioner, a doctor, prescribes medication. Otherwise, we don't need medication to help and support children with ADHD. We can perhaps offer them occupational or behavior therapy would often help them. Parent training. Both teachers and parents should be trained to support and help children with ADHD, and parents should in turn train their own children as well. Schools can do a lot in supporting children with ADHD. It is important to provide them with a structured routine. See, they find it very difficult to follow routine. So we may have to, the parents or the teachers will have to help them prepare a routine and keep reminding them of following that routine. And we should be providing them with emotional support. Now, one thing I really want to tell the parent community or the teachers who are listening to me is that, look, bad parenting is not the cause of children with ADHD. Let us not blame parents. It is a neurodevelopmental condition, and parenting has nothing to do with the children developing ADHD. They have already developed it when they were born. So what we can do is to work with the parents and help and support them, support the children. Now, uh, the one more thing I would like to tell the parent community. I'm sorry. One more thing I would like to tell the parent community is that, see, like sometimes people say, the child has ADHD because the child is has too much of screen time and other reasons. Maybe screen time can probably aggravate ADHD, but we have no evidence to believe that screen time is the reason for children developing ADHD. It could probably aggravate ADHD. So it's important that we restrict screen time for children. Very, very important. But it is not wise to blame it on such reasons. Most children with ADHD can grow into creative, successful, and resilient adults provided we do what we can in supporting them. Let's continue doing our good work. Thank you.